Thank you to everyone who's joined us this afternoon or this morning if you're on the West Coast. We welcome you to the 9th installment of the monthly series, Who's Leading the Leading Health Indicators. Each month, this series will highlight an organization, state, or community addressing one of the Healthy People 2020 Leading Health Indicators, or LHIs as we call them. The series includes a monthly webinar, email bulletin, and active conversations via Twitter and LinkedIn. Today's webinar, you'll hear from several distinguished speakers. First, Dr. Don Wright, HHS Deputy Assistant Secretary for Disease Prevention and Health Promotion, will give you an overview of this month's LHI topic, which is social determinants. From the Institute for Research and Reform in Education, Dr. James Connell will discuss First Things First, a program focused on school-wide education strategies that has shown substantial improvements in students' graduation rates and performance when it's implemented in schools. And we're also lucky to be joined today by several panelists from across the federal government and outside of the government. Dr. Nadine Gracia is the Acting Deputy Assistant Secretary for Minority Health at the Department of Health and Human Services. Randy Speck is the Superintendent of the Madison District Public Schools in Detroit. Mary Stewart is a Principal at Wyandotte High School in Kansas City, Kansas. And Sarah Allen is an Education Program Specialist in the U.S. Department of Education. So we're thrilled to have these panelists with us today, and they will participate during the roundtable or Q&A portion of the webinar. But before we turn the mic over to Dr. Wright and our guest speaker, I'd like to give you a little bit of background on the leading health indicators in Healthy People for those of you who may be new to our family. For 4 decades, Healthy People has provided a comprehensive set of 10-year objectives that have served as a framework for public health activities at all levels and across the public health community. Healthy People is about understanding where we are now and taking informed action to get where we want to go over a 10-year period. The leading health indicators, which is the focus of this series, represent critical health issues that, if addressed appropriately, will dramatically reduce the leading causes of preventable death and illness. They have been selected to communicate high-priority health issues to the public, along with actions that can be taken to address them, with the overall goal of improving health of the entire population. So for the complete list of the leading health indicators, of which there are 12 topics, please go to healthypeople.gov. So with that, I'd like to turn the webinar over to Dr. Wright. So Don, you're on.
Thank you, Carter. Before we hear from Dr. Connell, I'd like to take just a few minutes to give you a brief overview on this month's LHI topic. Next slide. Next, the social determinant of health leading health indicator is students who graduate with a regular diploma 4 years after starting 9th grade. The selection of social determinants as a leading health topic recognizes the critical role of home, school, workplace, neighborhood, and community in improving health. Although education is the leading health indicator topic for this topic, the social determinants extend beyond education and include the physical environment, income status, social support networks, access to health services, and a range of other determinants. Next slide. Many predictors of individual and population health and well-being fall outside of the healthcare setting. A range of personal, social, economic, and environmental factors contribute to individual and population health. For example, people with a quality education, stable employment, safe homes and neighborhoods, and access to preventive services tend to be healthier throughout their lives. Education, a leading social determinant, is key to improving the health of the nation. People with higher education levels are more likely to live longer, healthier lives. According to the Center for Disease Control and Prevention, in 2006, 25-year-old men without a high school diploma had an average life expectancy that was 9.3 years less than those men with a bachelor's degree or higher. Women without a high school diploma had a life expectancy of 8.6 years less than those with bachelor degrees or higher. A 2011 study has shown that higher educational attainment was associated independently with lower prevalence of chronic diseases. Education also is associated with practicing health-promoting behaviors such as exercising regularly, refraining from smoking, and obtaining timely health checkups and screenings. In the next few slides, I will present the latest data on the social determinants: on-time high school graduation within 4 years of starting the 9th grade. Next slide. On-time graduation estimates, as you can see from this slide, have increased from 72.6% in the 2001-2002 school year to 75.5% in the 2008-2009 school year. Despite that improvement, you can see from this slide that we still have significant progress to make in order to achieve our Healthy People 2020 target of 82.4%. Next slide. On-time graduation rates vary by race and ethnicity. Among racial and ethnic groups, the Asian or Pacific Islander non-Hispanic population has the highest rate of on-time graduation, 91.8% for the 2008-2009 school year. Black non-Hispanics had the lowest rate of on-time graduation at 63.5%. Certainly, knowing where disparities exist can help communities, states, and the nation prioritize and target resources for populations that are in greatest need. Next slide. For the 2008-2009 school year, on-time graduation estimates range from 56.3% in Nevada to 90.7% in Wisconsin. On-time graduation estimates are generally higher in the north than they are in the south, with high rates clustered in the north-central states as well as parts of the Northeast and New England, and low rates are mostly clustered in the Southeast. At this point in the presentation, I'd like to turn the webinar over to Dr. Connell to talk about a program that is being implemented in states across the nation and has shown an increase in high school graduation rates.